Gonorrhea is a sexually transmitted infection caused by the bacterium Neisseria gonorrhoeae. This bacterium primarily infects the mucous membranes of the reproductive tract, but it can also affect the mouth, throat, eyes, and rectum. Gonorrhea is transmitted through sexual contact with an infected person. It can also be passed from a pregnant woman to her baby during childbirth. Gonorrhea symptoms vary between men and women, and some people may not experience any symptoms at all. When symptoms do occur, they usually appear within 2 to 14 days after exposure. In men, the symptoms include painful urination, pus-like discharge from the penis that could be white, yellow, or green, swelling or pain in one testicle, sore throat if the infection is in the throat. In women, the symptoms include increased vaginal discharge, painful urination, vaginal bleeding between periods, such as after vaginal intercourse, abdominal or pelvic pain, and sore throat if the infection is in the throat. Rectal infections in both men and women may present with discharge, anal itching, soreness or pain, bleeding, and painful bowel movements. The diagnosis of gonorrhea begins with the healthcare provider taking a detailed sexual history and performing a physical exam to look for signs of infection, such as discharge, sores, or other abnormal findings in the genital area or throat. Nucleic Acid Amplification Test is the most common and accurate test for gonorrhea. A sample is collected from the affected site, such as urethra, cervix, rectum, or throat using a swab. Urine samples can also be tested for gonorrhea in some cases. Culture test is less commonly used but can help in cases where antibiotic resistance is suspected. A sample is grown in the lab to detect the presence of Neisseria gonorrhoeae, Gram stain for men with urethral discharge. This can provide a quick diagnosis by detecting gonococcal bacteria under a microscope, but it is less sensitive than nucleic acid amplification test. Gonorrhea is treatable with antibiotics, but it is becoming increasingly resistant to many drugs. Ceftriaxone 500 mg intramuscular injection in a single dose for individuals weighing less than 150 kilograms. For individuals weighing 150 kilograms or more, the dose should be increased to 1 gram of ceftriaxone IM in a single dose. For patients with confirmed co-infection with chlamydia, or if chlamydia infection has not been excluded, add doxycycline 100 mg orally twice daily for 7 days. For patients with cephalosporin allergy or other contraindications, alternative regimens such as gentamicin may be used, but these regimens are less preferred due to reduced efficacy or more side effects. Patients with gonorrhea should be treated empirically for chlamydia. Untreated gonorrhea can lead to serious health problems. In women, pelvic inflammatory disease, which can cause chronic pain, ectopic pregnancy, and infertility. In men, epididymitis, a painful condition of the testicles that can lead to infertility. In both genders, disseminated gonococcal infection, which can cause joint pain, skin lesions, and potentially life-threatening conditions like endocarditis or meningitis. Preventing gonorrhea involves practicing safe sex and being aware of potential risks. Consistent and correct use of condoms during all sexual activity significantly reduces the risk of transmission. Regular STI screenings, especially if you have multiple partners, help in early detection and treatment. Being in a long-term, mutually monogamous relationship with a partner who has tested negative for STI lowers the risk of contracting gonorrhea. Abstaining from sexual activity or avoiding sexual contact with partners who show symptoms of STI is also a key preventive measure. If you found this video helpful, don't forget to like, share, and subscribe for more informative health content. Stay tuned for our next video.